week, the health programme will be looking into the case of rare diseases. They affect more than 3 million people in France. A few days ago was held the first European Rare Disease Day, a day for establishing these diseases as a real public health problem. We're at the Alliance Maladies Rares in Paris. In France, 3 million people have a pathology of this kind. A disease is called rare when it concerns less than 1 out of 2,000 people. This means that in France, for one illness, there are less than 30,000 sick individuals. We can now count 7,000 to 8,000 rare diseases. We believe that 80% of them are of genetic origin. The remaining 20% can be infectious or autoimmune diseases, or ones of which we don't know the origin. Here is Chloe, her mum and her grandmother. Chloe is 9 and has Ondine syndrome. In France, this rare disease is of genetic origin. It affects 1 out of 200,000 people. Ondine syndrome is a deficiency in the respiratory system, but more so in the brain. When you dive deep in water, normally at a certain point your body will tell you that you have to go back to the surface because you have too much carbonic gas and not enough oxygen in your system. These children cannot do this in their sleep stages, when they're very tired, when they're ill, and sometimes in moments of hyper-concentration. So we have to compensate for that with a ventilation system. A machine that helps her breathe at night. Normally, when we sleep, our brain automatically regulates our breathing. Chloe's brain cannot do this, which means this ventilation system is indispensable. I put the machine on, and when I turn it on, I can feel air in my tracheotomy, and also a little bit in my neck. When I breathe in, and then my brain feels a little better. In France, a rare diseases programme was created in 2004. It finished at the end of 2008. It made it possible to inform, finance research and create a French network of specialised centres. Here we are in the reference centre specialising in Ondine syndrome, a disease about which we know more since 2003 and the discovery of a genetic mutation responsible for this pathology. It's still a recent discovery. Experimental studies are ongoing. We're trying to understand the physiopathology, to understand how the disease works before moving on to a treatment. Hope for the 30 or so people who have this syndrome in France, but also for others, since a second French plan for rare diseases is expected for 2010.